Hello, good evening, good afternoon, ladies. How are you ladies doing for a hump day? All good? Hello, can I see anyone? Knock, knock. Yay, I can see one. Hello, come on, ladies. Thank you, Lalita. Thank you. Thank you for joining in. It's an interesting topic today. It's all about our physical health, right? We talk about our mental health. We talk about, our health as such in general. But today it's all about being physical, right? You run, you exercise, and you get injured, and you just need to know what happens, right? So that's the topic all about today. Thank you, ladies, for joining in. Thank you, Shweta. Thank you, Vidya. Thank you, Pratibha. Thank you, Jabin. Thank you, Shalini. Thank you, thank you, thank you. Thanks, Lalita, saying hi, Hema. Thank you. So how was your weekend? Weekend comes and goes, isn't it? And your week would have started already 3 days. It's hump day. So another 3 days, not even 3 days, like 2 days, you have your weekend. Yay! And how are you ladies surviving the COVID, right? The exposure, it's just been rampant and, some can go to work, some cannot go to work, all sorts of things happening, right? Good afternoon, madam. Who is this? You can call me Hema. I know I've told you, Lata Nagraj aunty, you can call me Hema. Thank you so much. Thank you, thank you, thank you. Great. So how was your Wednesday? Did you all go to work or work from home or been busy? It just comes and goes, especially don't even have some breathing space in between. It's just gone so quick. And just come next week, the month of January is gone and February kind of disappears in ether because it's just so short. It just goes away. We are all fine, thank you. Wow, I like that. Thank you, thank you. So you have got the Kannada Baraha on your phone, I think. So that's very nice. That's sweet. Good. I've got pretty good numbers here. Thank you, ladies, for joining in. Welcome to Wholesome Wednesday session number 84. It's all about sarees and technically speaking, it's called physiotherapy or physical health in general, talking about how you can take care of your physical health as well as optimizing your physical function. So that's what we will be doing today. And I've got a gorgeous young Suma Katti who would be doing this session for us. So stay tuned. And as usual, I'll start off with the birthdays. I don't have that many today. I've got Shri Vidya and Alpana Shri Vastava celebrating the birthday. Happy birthday, ladies, and wishing again a happy birthday for all the ladies who celebrated their birthdays from last week up until today. If I missed out any, apologies there. So wishing you all a very, very happy birthday. And we talk about our national days. Today I have 2 national days. It's quite interesting. It's all about eating again. So it's called the World Quark Day. I don't know how many of you all have heard of the word quark. Quark is nothing but a delicious high protein and a low fat alternatives to soft cheese and yogurt that can be used for baking, cooking and blending. Some say it's kind of in between yogurt, and some it's kind of between yogurt and cheese, and it is very rich in protein, and it can be used in savories, in sweets, whatever you like it. So that's what we are celebrating today. So if you get a chance, you can just have a bite of it and enjoy them. And the next one is the National Popcorn Day. Who doesn't like popcorn? Popcorn and movie theaters go hand in hand, isn't it? So popcorn, you always think about movies, cinemas, yeah? And the traditional popcorn, which is just with a little bit of salt and butter, has undergone a tremendous change, and you get so many flavors of popcorn. And it's unbelievable the flavors what you get. But anyway, either way, anyone for that matter will enjoy popcorn, except me. I'm not a popcorn person. But if you get a chance, or if you're watching a movie, just enjoy that popcorn there today. Yeah? So before that, I start my session, I talk about my sari. And today I have a special guest with me. And I'm very delighted to present my gorgeous mom, who has arrived from India on Saturday. My boys didn't know that she was coming, and it was a surprise visit. So I organized it within 3 days, and she's here with me. So she will be a guest appearance on All the Wholesome Wednesdays in her gorgeous KSIC saris. And today she is in her gorgeous KSIC sari. And this is what the sari is. She's showcasing the sari for me. So it's so beautiful, and she has draped it so well. Wish I was the size of her. So those are the saris. I think I have made several blogs about KSIC sari. It just comes with a label, and each sari is so unique. It has got its own label sewed in, and also a hologram as well. And so those are the saris from Mysore, and they are hand spun and beautiful, beautiful. It's wash and wear, nothing happens. The more you wash, the more lustrous it is. Only problem with that is oil. Just be careful that you don't drop any oil. So that's what the sari is. Beautiful, kind of like, it's a maroonish color, beautiful border. So that's what mom is wearing today. And yeah, and each sari, most of the time they have these traditional pallus, and yeah, so they have these traditional pallus, and you get the replica ones as well, similar to that, but you can easily make out a KSIC sari. The feel of it, the touch of it, you can just easily make out. So these are the KSIC saris. Thank you, Mom. And today's drape of mine is a Maheshwari cotton silk sari, and Maheshwari saris come from Madhya Pradesh, and it's a small town in Madhya Pradesh called Maheshwar, and that is where the saris are made. They are handmade, hand woven, and initially it used to be cotton and then silk. And now the trend of cotton silk has started. So this is what the sari is. And the interesting part of these saris are these borders on the edge are reversible, meaning to say that you can wear this sari on both the sides. So that's how it is. And they kind of like don't make this edging on the other side. So that's the other drawback. But these are the beautiful saris wherein the edge is reversible. So these are lightweight, and there is a little story behind these saris. It seems so Queen Ahalya Bai Holkar wanted a very different drape, and she had artisans from Malwa and Surat come in and weave the beautiful 9-yard drape. And that's when they came up with these Maheshwar saris, and that's why it was very popular in those days, and it was also worn at the weddings and parties, and it was also a royal gift. So if anyone had the chance to visit the royals, that is Queen Holkar's family, you would get a Maheshwar silk sari. So that's how famous it was, and that was the gift that was given in those days. So that's the spiel behind the Maheshwar saris. Yeah, and before I start, and as you all know, today we are talking about physical health. So I just love this quote by Denis Waitley, which says, "Time and health are two precious assets that we don't recognize and appreciate until they have been depleted." This is so true. So just taking care of your body from an experienced physiotherapist would be the session tonight, which we will be joining in very shortly. I'll just see whether I can bring Suma in. Suma, can you just send me a request? I've already added you. It should be flashing. And in the interim, I have quite a few of them. I'll just say hello to them whilst you are doing that. So I think I stopped somewhere. Shweta, I finished. Vidya, thank you. Thank you, Jabin. Thank you, Shubha. Thank you. Thank you, Lata. Thank you, Kruti. Thank you, Gayatri. Shweta saying, hello, Auntie. Hello. Mamta, thank you for joining in. Malini, thank you for joining in. Kruti saying, Mysore silk saris always rock. Love the feel of it. You're absolutely true. And mom, coming from the background of grandpa being working in the KSIC industry, the whole family still very fondly wear Mysore silk saris, and it's so precious, right? Chitra, thank you so much. Bhavya, thank you. Rupa, thank you. Rekha, thank you. Thank you, ladies, for joining in. So I will be introducing Suma in a minute. Suma, can you try again, please? I can't add you until you come on the frame, because it will be sitting in your notification folder. Perhaps, no, I can't. Try coming in. It takes a little bit of time. And in the interim, I'll try and introduce you to my lovely audience. So you have accepted the invite. Okay. Accepted the invite to host. Thank you, Suma. It should come through, and it hasn't come through, and I cannot add you unless the system releases you. So that's where it is sitting at. It's kind of like, it's in between, it's like a threshold. So you have to cross the threshold and come into my feed for me to accept you. So I'll just wait for some more time. It kind of takes a little bit of time sometimes. We'll just wait. And in the interim, let me see, I'll just introduce you. I know that you are there. Thank you for joining in. Sorry, ladies, it's a little bit of technical difficulty there, but I think it should be sorted very soon. If I cannot bring her, Suma is ready to start her own session. So just be... just wait. I think I'm very optimistic. I should be able to bring her, right? So Suma Katti, I have known her since she was little, very little, and she always used to run. So both the parents and Suma, they always used to run. And befittingly, it fits her. She's an athlete as well. So just a brief introduction of hers is we always used to see her running. So that would be the intro of Suma. But growing up, she's now a physiotherapist by profession and an athlete, which I mentioned, ready to talk about our human movement disorders. When she was 11 years of age, she had to see a physiotherapist for a running injury. And this experience triggered her interest in wanting to become a physiotherapist, and thus a good example of becoming one. So indeed, she's a very good physiotherapist. and she graduated doing physiotherapy. And she's been working as a physiotherapist for the last 6 years. And she started off working in a hospital setting before starting work in a private practice. She has had exposure to many different conditions, helping her clients rehabilitate from orthopedic, muscular, and neurological injuries. Outside of work, she loves her sports. She watches as well as plays them. She tries to keep active by running, playing soccer, and doing Pilates. So, ladies, if you have any questions about, like maybe exercise injury or, like a physical injury or, okay, you're doing a yoga, you might have turned and twisted something, or you're running or you're climbing up the stairs, something might have happened. So throw all those questions for her and she will be ready to answer them. And just a little spiel about physiotherapists, like every country has got a different title. So here in Australia, we call them as physiotherapists, but in US and other countries, sometimes they call them as physical therapists. So both physiotherapy and physical therapy are one and the same. So get ready. Suma, just try one last minute, exit and then come back and see whether it will let you. Okay, till then I will be chatting a little bit away. Can you see whether you can exit and come back? I've just said yes. Just for you, just exit and come back and see whether you can accept the request easily. I don't know why it's not doing. I was so confident because my system is I have accepted the invite. Yeah. My system is once I tag someone, the flow is very easy. So that's the indication of no technology glitch, but sometimes you never know with technology, isn't it? I stopped somewhere here. I'll just call out a few names. Chitra, thank you for joining in. Bhavya, thank you. Rupa, thank you. Namita, thank you. Yeah, we'll just wait for not 2 minutes, I'll say 1 minute and see whether Suma can come in again. And hopefully that will make it easy because I can have a few questions for her. And if you are thinking, to host a show, it's very important, to learn a little bit about what we are talking about. Just a little bit of it, not fully though, obviously. You can't master everything. And I try and input a little bit and get some information. So it's easy for me to carry on with the show without any interruption. And it will all be general basic questions. But if you have any questions that you need to ask, just pop that. Oh, it's not changing anything once I have accepted. Sorry, ladies. Are you able to send me the invite again? It's not changing anything once I have accepted. Unfortunately, I can't because I have to finish and come back again. So what I will do, let me see if there is any other way. No. Why is it saying? No, I don't know why it is not letting me. So what I'll do, Suma, I'll just finish this off and then I'll bring you again, or you start the session and I will join you. Okay, let us see how it goes. Okay, I'll try again. I don't know why it's not letting me. It hasn't filtered through your name and I can't see that. Okay, sorry ladies, I have to restart this session on the same page. It's just a little bit of technical glitch there. So try and stay there in the same platform. We will be there with you in less than a minute. Okay, I'll finish this off. And either Suma will be joining in or I will be joining her session. We'll see how it goes, but it will definitely happen. Don't run away. Okay.
Hi everyone, I'm so sorry about all the technical issues. Hopefully you can hear me. I'm just going to see. Oh. If you can hear me properly and everything, can you just type a comment or just let me know? Brilliant. Okay. Thank you so much. I'm so sorry again about all the technical difficulties. Even being from, I guess, the millennial generation, I'm still quite bad with technology, but unfortunately something wasn't working too well. But hopefully we can still get through, the things that I wanted to go through, and hopefully, I can answer your questions as well. So feel free to, post any questions that you might have about physiotherapy or any physical health conditions as well. I'm just going to quickly pop this up. Okay, brilliant. Okay, all right. Does anyone have anything to start off with? You can just start posting your questions if you'd like. Otherwise, I might just start off with a few topics that I thought might be quite relevant for me to talk about, with you all, considering, it's an amazing group of very strong, beautiful women who love their saris. So I chose a few topics that I thought might be very relevant to females and women. So starting off, I thought I'd talk about pelvic health. So I think it's a very little known fact that physiotherapists actually deal with a lot of pelvic health issues, including but not limited to things like urinary incontinence, bowel incontinence, or bowel issues, pelvic pain and dysfunctions, and obviously postnatal and prenatal pain and other issues as well. So in terms of that, obviously, I'm just reading the questions quickly. Oh no, the comments, sorry. Okay, perfect. The questions will follow. So if you have any questions about any of these topics, please feel free to ask and we'll go through. But just in terms of what I was talking about, so pelvic health, I guess, like I said, it's a very little known sort of subject. I think it's still quite a taboo subject in many cultures, including ours, that we don't really talk about these sorts of things. And we know that, it's all very natural. These issues affect, so many people. Even things like urinary incontinence, it affects such a huge, demographic of people, not just females, men as well, but it's just not, widely talked about. It's not widely dealt with. So I thought, I'd talk a little bit about that, just in terms of what we do as physiotherapists, or what we can do as physiotherapists for these sorts of issues. So just a little bit of background. When I talk about something like urinary incontinence, there's many different causes and many different triggers for these sorts of problems to come about. So if I'm talking about urinary incontinence, there are two main types. The first one is stress incontinence, and this may be something that is much more common throughout the age group. So many people would associate something like this with older women, for example, but it's actually a very common problem even amongst very young females as well. And stress incontinence, what it is really is basically it's pressure on the bladder that comes from an increase in abdominal pressure or activities that cause increases in abdominal pressure. So things like coughing, sneezing, laughing, and I have to admit, so I'm going to put it out there, I sometimes feel it when I'm running. So it's a very common problem. Like I said, it might be very embarrassing for some to talk about or to have, to see someone about as well. But I think it's very important to deal with because it can limit you in things that you do in your day-to-day life, even just your general activities. I know personally I've seen patients who have maybe stopped exercising the way that they want to because they are embarrassed by stress incontinence. The other type of incontinence is urge incontinence. This is a little bit more related to the bladder itself and I guess the pressures going through the bladder. It's more to do with feeling like you need to go or not being able to really control that urge very well. And there's a common link between, certain bladder behaviors and this type of incontinence. Yeah, urge incontinence, that's right. So in terms of urge incontinence, there is still methods that we can use to help deal with this, but we tend, as physiotherapists, we probably can help a little bit more with the stress incontinence side of things. But with stress incontinence, so just to quickly go into that, I guess treatment, I should have said at the start, treatment for all these sorts of problems obviously very individual. It's always best to see someone if you do feel like you have these problems. I can just give a general overview tonight, obviously, and hopefully, I guess from this talk, maybe if you do, realize that maybe you are dealing with any of these issues that I will get into, please think about, seeing a physiotherapist, or even at least starting off with your GP and then considering whether you might need to see a physiotherapist for any of these problems that we talk about tonight. But yeah, sorry, going back to the stress incontinence. So one of the things that I'll touch on a little bit later with is your basically building up your pelvic floor and your pelvic strength, your pelvic muscle strength. So the pelvic floor, if we just come to that, is a very important part of our bodies, not just for the, obviously, the pelvic, like the parts of our body around the pelvis, but it's actually very important throughout the whole body to help with our posture, to help with our support through our spine and things like that as well. And that's because the pelvic floor is pretty much the base of of what we call our core. So our core is made up essentially of the pelvic floor underneath, then we have our diaphragm at the top, and then we have deeper abdominal muscles that sit around the sides, and that all holds pretty much all of this in. It helps support us and really helps keep us upright and keeps our spine stable as well. So I'll come back to that a little bit later, but basically a lot of these pelvic issues can be dealt with, through some of these pelvic floor and pelvic exercises that physiotherapists, like to prescribe. going back to some other things, sorry, I know Hermanti's written about the constipation. So again, bowel issues, you wouldn't really consider seeing a physiotherapist for, bowel issues that you may have. Now, saying that we don't deal with a lot of things related to the bowel, most things do, in terms of bowel issues, obviously there are other things that need to be looked at as well. But in terms of, things like if you're getting constipated, you're generally going to be putting, again, a lot of pressure through your pelvic area. You could end up with back pain. You could end up with hip or pelvis pain. So we do deal with, a lot of pain issues that can arise from things like bowel constipation. Now, I thought I'd throw in this tip because when I learned it, through my studies, I found it quite interesting. Again, considering, all of you beautiful women out there who I'm assuming most of you are, from India or from the subcontinent, you'll be happy to know that one of the best ways to actually go to the toilet to do a number 2 is to go in more of a squatting position. Now, we know our toilets aren't set up for that here in Australia. We're obviously used to the Western toilets. I have to admit, again, when I go back to India, I do feel a little bit, I get a little bit tired of going to the squat toilets, but they're actually one of the best methods to do a number 2. Now, a good way of mimicking that sort of setting in our Western households or where you have a Western toilet is is to basically, get into a semi-squat sort of position. So what I mean by that, so I'm just going to quickly show you. So obviously with a lot of our Western toilets, what happens is our knees sit below the line of our hips. So our hips are higher than our knees and they angle forward like this. Ideally, what we want to do is bring our knees higher than our hips. So for that, you want to, so as Hermanti suggested, you want to try and use a small step or a small stool underneath your feet, just so you can have your knees a little bit higher than the line of your hips to bring on that squat position. So what that will ideally do is take off pressure because of so it's actually more to do with the internal mechanisms of the digestive system. The way the bowel actually ends is it curves underneath us, similar to the way our tailbone curves underneath our spine. So we want to use that angle to try and actually efficiently clear our bodies, I guess. That's just one tip that I thought was very interesting. That if you do tend to have pain with doing a number 2, or you feel or you have problems with constipation, try that position and see if you can mimic that squatting position that we tend to use back in India to help you do that. So that's just with the bowel side of things. And Hermanti's asked about some heavy lifting as well. So heavy lifting, can you use weights in the gym? So I think, is that in terms of the pelvic issues, the weights in the gym? I'll come back to that. But just moving forward, so definitely a couple of issues that we've already talked about in terms of pelvic health. If you do feel like you have any, any problems that might be that you might need to see someone for, definitely try a physiotherapist to help you sort of get that motor control of your pelvic floor, and to see if you can efficiently do the things that you need to with your body, but without bringing on pain or causing issues with other parts of your body as well. I'll just quickly touch on the postnatal and prenatal issues. There's not a lot to say with that. Again, it's something that a lot of physiotherapists actually deal with as well, because with pregnancy, obviously the body changes so much. So it's not just, an issue about another human growing inside and having the extra weight causing back pain and things like that. There's also the other factor about internal changes. So things like hormones causing ligament laxity, and so the ligaments become more flexible, and that causes more changes in the pelvis generally, but also through the hips, the lower back, and areas like that. So physiotherapists are quite highly involved with a lot of prenatal or postnatal care. Again, the postnatal side can also touch on with the urinary incontinence and those sorts of issues as well. So if you do have any specific questions about that, please feel free to ask. Otherwise, if you feel like you might be dealing with any of these issues, think about having a chat to a physiotherapist. Throw me some questions. I'm happy to answer them too. So hopefully that just gives you a little bit of information about that. I'm really sorry. I know I've been a little bit in and out of topics. I guess, again, because of the technical difficulties, we sort of had a little setup, but as plans didn't go accordingly, unfortunately, I'm just sort of going, with the flow. So if you have anything to add in or anything to ask, feel free to. But otherwise, I'm just going to move on to the next part that I wanted to really touch base with. So this is about bone and joint health. And I know it's been discussed in the past on this lovely platform as well. And I'm sure, most of you would have heard a lot about, a lot of these issues to do with osteoporosis and osteoarthritis and things like that. But I might just go through it a little bit more thoroughly, and that way, again, if you have any questions, please feel free to throw them out. But if we talk about these topics, I know that there's a lot of confusion between what these terms all mean. They all sound the same, osteo this, osteo that. What does each mean? Basically, so osteoarthritis, it's to do with the joint. So osteoarthritis is to do with breakdown of the cartilage. There are other structures involved as well, your synovial fluid and things like that. You don't really need to go into the full depth of it to understand. But basically, osteoarthritis is to do with the joint. So this is an issue that we tend to see more so generally in weight-bearing joints. So joints, bigger joints in the body that tend to take our weight, knees, hips, shoulders, and then, through the spine and other areas as well, you can definitely see osteoarthritis. Osteoarthritis, there's a lot of research obviously coming out in relation to the best way to manage osteoarthritis and the symptoms that go along with it. Basically, so if we actually have a look at statistics and things like that, one of the big reasons for so much more research being done into it is because there's a lot more many more people who are actually unfortunately suffering from osteoarthritis and then having to take the next step to actually have surgical management for these issues. So what we really want to get to is a point where we can prevent problems such as these occurring, or at least prevent them from getting to a stage where they need to be surgically managed. So total knee replacements, for example, I think the statistic is very scary. I think by 2030, they're expecting in Australia alone that the number of total knee replacements will increase by more than 250%. And if we think about that, it's not just an individual problem. It's not just something that, you know, the individual suffers with, but there's a lot of other far greater consequences of that, even just for the healthcare system. I mean, we're seeing it now at the moment, unfortunately, with COVID wreaking havoc on the healthcare system. But if you can imagine, you know, if you can think about 250% increases in just total knee replacements, then you have to think about, you know, total hip replacements, shoulder replacements, etc., etc. So one of the big focuses at the moment is really on prevention. So there is definitely, Hemant is asked, can you prevent undergoing surgery? You definitely can, and that is your main aim. If you do start to, or even if you're not feeling any symptoms at all, or even if you've never, you know, if you haven't been diagnosed with osteoarthritis, you still want to work on ways where you can actually prevent having problems with it in the first place. Now, I know it's a lot easier said than done. Osteoarthritis is, you know, a significant problem, and it's a very common one that tends to arise generally, unfortunately, after you know, a certain age. It becomes very common, and it's not entirely preventable. It does, you know, there are lots of risk factors, including even just a lot of you know, previous injuries or things like that when you're young. So it's not necessarily a disease or a condition of, you know, unhealthy people. So a lot of you know, former athletes are now unfortunately dealing with the consequences of osteoarthritis just from I guess wear and tear. We use the words wear and tear, but it's a lot more complex than that. So I think they're trying to move away from just calling it a wear and tear injury. But yeah, definitely can be preventable by things that you do now. So one of those things, one of the big things actually is trying to do some exercise training. And I know it sounds counteractive, especially after what I just told you, but there is, I guess, a fine line. There's a balance between doing too much and not doing enough. We want to sit in the middle and try and actually get enough exercise, and that includes strength training and fitness or general cardio training as well, to be able to, I guess, better manage and prevent osteoarthritis from getting worse. So there was recently a study. Done on running, and whether it was actually harmful for the knees. And what they found was from running, again, this is very simply put, but from the movement in running, it actually helped to nourish the cartilage. So it actually, the movement caused you know, some nourishment of the cartilage, which helped to manage the symptoms, or to again, to prevent the osteoarthritis in this population that was studied from getting worse. So that's one big factor. So really, you know, being able to do exercise training to help with your to help with prevention. Other things though, and this is again now a really big focus that a lot of I guess industries are moving towards, including physiotherapy. We like to look at things holistically, and I know a lot of you know, I guess alternative medicines or you know, I guess natural medicines do tend to look at these factors as well. So we're talking about sleep, we're talking about diet, we're talking about you know, stress. So you know, these are, I guess, more natural factors. The other things are obviously you can have pharmacological, so medical management. So, you know, there is some what's the word? Some scope for pain management and things like that via actual I guess medical you know, treatments, so painkillers and things like that. But if we can work on the more natural things as well, or the more holistic things, that's something that is relatively easy for us to start off with. So alternative medicine, so definitely I think, a lot of people are now turning towards the things that, I guess, again, a lot of us would have known through our Ayurveda and our own cuisine, things like turmeric and curcumin and things like that. To be honest, there's still not a lot of scientific research done on that, but I think it all does combine in terms of the management. Yeah, so the holistic approach for it. So when we do talk about management for osteoarthritis now, it's not just about, trying to reduce your pain with painkillers. It's using that as one, small branch, but then thinking about like I said, your diet. Are there any ways that you can reduce the inflammation through the food? So there's, again, a lot of research being done on sugars and how they might be causing increased inflammation even in the joints. Then we talk about your sleep. Are you getting enough rest? Are you reducing your stress levels? Because again, stress is an inflammatory factor. So if we can work on these things, then you're definitely able to that's what we talk about, I guess, when we talk about prevention of something like osteoarthritis. Lalita Auntie has asked about brisk walking more than 1 hour every day. It's absolutely fine. And so when I said there's the fine line or the balance that you want to get, generally the opposite, or the extreme end of not doing anything is to do too much. So what we mean by that is, if you're doing marathons, if you're if you're running yourself to a point where your body's not coping and you're really feeling the effects of it. So your body is your greatest indicator. It will tell you when something is too much. If you do start to notice pain, if you start to notice any symptoms in those joints, then that's when it's saying it's a little bit too much. Let's ease it off. Sorry, I know I've talked a lot about that, but I'll come round to that in a second. But yeah, basically, it's fine to do things like walking more than an hour. It's just making sure that you're not overloading your body. And Hemant, you've asked cardio sessions twice a day. Absolutely. Again, as long as your body is coping with it. So normally, again, indicators. So obviously, besides the pain and things like that, if you're feeling very fatigued at the end of the day, and if that is lingering on to the next day, if you wake up the next day and you're feeling like you can't do your normal activities as you would, if you're feeling very tired, that's a big indication that maybe you need to just ease off on what you're doing in terms of the cardio sessions as well. So big symptoms to look out for are pain, fatigue, I guess any other sort of things that you don't normally feel if you're doing that activity. If you feel something is not feeling not feeling right about what you just did, maybe just ease up on it and reassess whether it's something that your body can cope with. So sorry, I've just talked about osteoarthritis. I'm coming to osteoporosis and osteopenia. So osteopenia, it's not a term that we hear about a lot, but basically there is a spectrum. So we start off with very good bone density and bone health. Then if we start to reduce density, if we start to not have as much strength in our bones, then we get to a point where we have something called osteopenia. If then it gets worse and your bones become very light and brittle, that's when it gets to a point called osteoporosis. Osteoporosis, so in the word it says porosis, which is similar to porous. So if you think about a sponge, if you have a sponge and it's got very small, tight packed holes, it's a little bit harder, and it doesn't really squeeze down as much. That's good bone density. When you come to a sponge with a lot of air in it, where there's big holes and it's very easy to squeeze, that's similar to osteoporosis. I thought I'd do a quick case study, since I've got a live subject here. So as Hema Auntie had, my mum is here as well, all decked up in her sari. So I thought I'd quickly mention her story. Now, unfortunately, some of you may know, about 6 months ago, my mum had it was a seemingly small fall. Now, if she was, maybe if this happened 20 years ago to her, or, if it was me who fell in the same manner as her, more likely than not, we wouldn't have had the same injury. We would not have had the wrist fracture that my mum had. Now, my mum, unfortunately, because she's got osteoporosis, she ended up fracturing her wrist. So really what osteoporosis does is, because the bone becomes so light and brittle, it means that even a small fall, stumble, or hit can be a risk for you to fracture a bone. So in terms of osteoporosis, it's different to osteoarthritis, like I said, because this is to do with the actual bone itself. So in terms of strengthening a bone, it's not something that we can just we can't just do bicep curls and see that our bone gets stronger. But similar to our muscles, our bones actually also need some sort of resistance training to make them stronger. So that's again another big reason for us to work on to work through some exercises to actually help with preventing something like osteoporosis as well. There's a lot of risk factors for osteoporosis, and unfortunately one of the big ones is menopause and being a female, because we always get the short end of the stick. So if you're a female above the age of 50, or if you've gone through menopause, please start to work on your bone strength through making sure you're getting enough vitamin D and calcium, through making sure you're getting some strength training as well. And what I mean by strength training is strength and resistance training is actually trying to build up your muscles. So using weights, doing body weight exercises. So things like squats, calf raises, where you're standing up and down on your toes. You can stand up and sit down on a chair, do that, a few times. And things like that, where we're really building muscle, but also using, some resistance even from the ground as well. So, like I said, unfortunately, we don't have the scope at the moment to go through a whole program of exercises, but please, feel free to speak to me or to a physiotherapist, or even your local GPs about this, to get some ideas on what things that you can do to help, help prevent something like osteoporosis. I'm just coming to some other questions as well. So Mama Thankti's asked, how do I make my hand muscles stronger or reduce pins and needles from carpal tunnel? So carpal tunnel, it's a little bit of a, it can be a bit of a difficult condition to treat. It is something that can be quite persistent, and it doesn't always respond very well to, a general treatment program. So some people unfortunately do need to have something more invasive to help them with their pins and needles. Essentially, it comes normally from repetitive movements and having inflammation, or thickening of the band of tissue here that puts pressure on the nerve that goes into the hand. That's why you feel the pins and needles and the tingling. So you can definitely do some exercises to help with that, but sometimes in some cases exercise can actually also make it more uncomfortable. But what you can try are things like grip strength exercises, so trying to increase your grip strength by maybe squeezing a stress ball, holding for a few seconds and then relaxing, trying that 10 to 15 times. You can also even do some finger exercises like that, and just, you know, trying to lengthen and stretch your finger muscles here. So just doing that and just you know, trying to give it a little bit of a stretch through the front there, also even through the elbow. So yeah, it's a little bit hard with carpal tunnel to know exactly what will work for it, but they're just some exercises that you can try for it. Sorry, coming back to the topic of exercise itself, and, you know, finding the fine line between what is too much and what is you know, I guess what's too little. We know that not doing anything is going to be too little, but doing too much. So I've talked about, you know, what your indicators are if you are doing too much, but just in terms of what sort of injuries they can cause. So obviously we know that if, you know, a muscle is stretched, or if it's taken beyond the point that it is working in, you can get muscle tears, muscle strains, but in other other injuries are also things like muscle tendon overloading. So you can get tendon injuries, and this is a very common group of injuries that tend to happen at a more specific age. So above the age of about 40, there's a lot of you know, people with shoulder tendon injuries. Actually, that's probably the most common one. So just quickly speaking about that again, there's similar to osteoarthritis, it's difficult to prevent entirely because it can be through you know, repetitive actions and work that we do. But again, to try and actually work on it, even though we're talking about overloading and not wanting to put too much pressure on it, or not wanting to load it more, what we still want to do is to strengthen the muscles around it to actually take more of the load of the injured tendons. So that would be the similar principle across, you know, any joints where you are sort of noticing these issues. So if you're noticing overloading issues, again, you might tend to have pain, you know, in the morning, or pain after an activity, or again the next day. So if you're feeling those sorts of symptoms after doing something in particular, like I said, it's probably a good indication that your body is just trying to do too much, and you just need to step it back a little bit. And just work on the strength before you can really get to a point where you're, you know, more capable of doing that activity. How do we know if we are fit in our age? There's a lot of different ways. That's a really good question, but there's a lot of different ways to know. But I guess the general rule of thumb will be, if you can do everything that you need to do, and if you can do everything that you want to do, then I'd say you're generally quite fit. I guess fitness, the definition of fit is different to everyone. So for me, I want to hope to, I don't know, be able to run 5 kilometers or something like that. Whereas my mum wants to, my mum wants to walk 2 kilometers. So, so our definitions of fit are very different, but as long as, you know, you're getting through the things that you need to be able to do, and you're not feeling that fatigue or other symptoms setting in, then I think you're generally in a good position. Are there any other questions at the moment? Or what I might do quickly is, the other thing that I wanted to quickly go through, before I wrap up is just a really quick chat about posture, because I know, again, this is something that has been very commonly talked about in the last year or 2 years since many people started working from home. I have had, unfortunately, a lot of clients come in to see me because they've had neck pain and other, back pain and things like that. So I guess the big thing to start off with is talking about posture. And so I want to just go through a quick little demonstration. So hopefully this will help everyone. It's not just for those working from home. This will definitely, be useful for anyone in anything that you're doing, whether it's cooking, whether it's, going for a walk, whether it's standing and, chatting to friends, whatever it is. I'm just going to take you through a quick little demonstration to help you just set yourself up in I guess, a good posture. But saying that as well, we say good posture, but really there's no perfect posture. It's just about making sure that we're not putting our body in a strenuous position. Okay, so to start off with, and like I said, you can do this in a standing position too, but I'm going to show you seated. So basically sitting down, what we want to make sure is that starting from our pelvis, so talking about, we talked about our pelvic floor, for example, before. What we want to do is try and actually engage those muscles. So if you think about where your tailbone is, so the bone just at the bottom of our spine that comes underneath us when we sit, we want to make sure that that is sitting curved underneath us. We're not arching our back too much and putting it under pressure, and we're not slumping like this. So what we want to do, so through our lower back, which is the bottom part of our spine there, we want to make sure that it's relatively straight, and we're sort of sitting upright there. If you take your hands and put them on the top of your hips, you can roll your hips forward and you'll notice that there's an arch in your back. If you roll your hips back, you'll notice there's a slump in your back. We want to try and find the middle position. Okay, so we come to the middle position, then we want to just engage those muscles. So quick little pelvic floor demonstration. So I'm sorry, this is a little bit crude, but if you think of yourself doing a number one, just pretend you're doing a number one and just slow it down. We're not stopping. We're not, trying to clench, or we're not trying to hold everything in. We're just gently slowing the flow. Okay. So hopefully that will just help you engage those muscles. And then if you come up a bit higher, our shoulder blades, we want to just tuck them in. So the shoulder blades are sitting at the back like this. We want to just gently guide them in like that. Then coming up to the neck and the chin, we want to make sure that there's a line just at the back of our neck there as well, as if someone has attached a balloon to the back of our head and is pulling up. Okay, so our chin is just tucked in. A lot of us tend to sit like this. We want to just pull it in a little bit. Okay, so that's just a really quick demonstration about posture and trying to, get everything engaging and working. But hopefully it just gives you a little bit of a tip on how you can sit and be seated. But you can also try this in a standing position, so hopefully you will feel those muscles engaging as well. Were there any other questions? I feel like I've been taking up a lot of time, I'm sorry, but if there's any questions, please feel free to throw them out. Shed light on neck pain, back pain, and knee pain. Okay. Okay, so neck pain and back pain are lumped together. So again, it's very difficult, I guess, to break it down into one into one main problem, as there's lots of different causes for issues around the neck and the back. But I think again, what we do tend to what our treatment definitely involves a lot of is, again, just ensuring that the right muscles are working to help support our spine. So obviously our spine is basically a long column of blocks. So anything that happens in the neck can also affect the lower back, and vice versa. So things happening in the lower back can affect the neck as well. So talking about the neck and the lower back, we want to make sure that, like I said, posture is definitely very important for it. But the other thing is trying to actually take pressure off the bones, off the column altogether, by trying to keep everything else around it strong. So again, if you imagine like a tower of blocks like this, generally we like to have the blocks sitting right over the top of each other. Otherwise, it's going to cause a lot of imbalance, or the weight distribution is going to be put off, which is going to then end up in things like pain, and you'll feel very uncomfortable and things like that. Generally, there's not a lot of movement through those areas, so you don't have to worry about that so much. But what we do want to do is try and actually have the weight falling through those blocks nice and evenly, and that starts from the neck and goes all the way down to our lower back. So like I said, exercise training is very important for that, trying to keep yourself nice and strong, and that even starts from little muscles in the neck. So it's probably, it's not something that you would normally see in a gym setting, for example. No one tends to just focus on their neck muscles. But a very simple neck exercise that you can do, and again, this is really good for everyone, is to and it's not the prettiest exercise, but it's to try and do a double chin movement. So again, if we talk about, like I did with the posture, talking about the back of the head being nice and straight, what we want to try and achieve is just our chin coming in like this, holding that for a few seconds, and then relaxing. Okay, so trying to pull that in, back of the head stays straight, and then relaxing. So that's something that I think everyone can practice and have a go of, and see how it feels. But it's a good way to actually work a lot of these smaller muscles that tend to be forgotten about, to help actually set up the posture here, so it will, sort of help through the, all the way through the spine as well. Were there any other questions at all? Oh, actually, one other thing. Again, sorry, going back to my case study with my mum. She's not very happy with me using her as a case study. But one of the other really big and important things that I should have mentioned before is to also really work on your balance. So balance, again, goes hand in hand with strength training. So strength can also help with your balance as well. But balance, we sometimes, I think, before I started doing physiotherapy, I thought balance is just for, maybe gymnasts and people who need to balance on a tightrope, for example. I didn't really think of the importance of it until I started doing physiotherapy. But again, really simple ways to work on balance are, even just trying to stand on one leg at a time. Maybe if that's too easy, you can stand on one leg and close your eyes, or try and reach to things. You can stand on, something that's nice and soft, so it's a little bit unstable. But the benefits of working on this are huge. So a lot of, obviously, unfortunately, again, once we get to a certain age, we do tend to lose, I guess, a little bit of the efficiency of our reflexes and receptors in our body that help with balance. And other things such as poor vision also contribute to balance problems as well. So, obviously there's huge problems, huge repercussions if we don't, work on our balance. Things like the risk of falls increases, it can lead to numerous problems in itself. So it's very important to also introduce a little bit of balance training into any sort of exercise training. So just quickly, I guess I've talked about these different types of exercises. So just to give you some guidelines, ideally, if you're, over the age, actually it doesn't really matter, but for everyone really, in a week, you want to try and do at least 2.5 to 5 hours of at least moderate physical activity. So that's, a brisk walk or something of the like. You want to try and do at least, that's 2.5 to 5 hours in a week. Then you want to try and do at least 2 days of strength training. So that's the things that I was talking about with weights, body resistance, doing things like your calf raises, squats, those sorts of exercises. Try and do them at least 2 days a week. And then on top of that, like I've just talked about as well, you want to try and have the balance. So if you try and maybe practice some of those balance exercises a few days a week, then you have a good program there to help you, with preventing some of these other issues that we've talked about earlier tonight as well. I had a question of your client's been. So here Mandy had a question for my mum. Oh. I have a question. Oh, sorry. If my clients have been used for a case study. I have a really good case study with my mom.
And she's really helping me.
So I've been trying to tell her the importance of balance, and so she's been practicing that.
Thank you so much.
Yeah, exactly right. So as if you've seen the comments, Hermione has just written the ratio of 2 days of strength exercise and 3 days of cardio is a perfect balance. Yeah. If hopefully that will give you some ideas on, how to, I guess, set your week as well if you're planning your exercise routines and things like that, especially being still the beginning of the year. Hopefully it's given you some inspiration to add that into your week. I've always been very passionate about trying to exercise myself, but then trying to get others around me to exercise. So please, again, if you have any questions about that, feel free to ask me. Did anyone else have any questions at all? Otherwise, I might just hang on a second. Sorry. If no one else had any questions, I might wrap it up. I can see that I've taken a lot of time, so I'm so sorry about that. Apologies again for the technical difficulties, but hopefully this has been helpful in some way. Hopefully you've learned something new or gained a new tip or something like that. But if if you do have any questions, feel free to either message me or comment. But thank you so much, everyone.
Thank you.